Pregnancy begins in the fallopian tube when a sperm fertilizes the egg. Over the next 5 days, the fertilized egg travels down the tube, dividing to form the embryo. The embryo attaches itself to the lining of your womb 5 days after fertilization. When you miss your period, you are 4 weeks pregnant. The embryo has been developing for 2 weeks, and the placenta and nervous system have started to develop. The heart begins to beat in week 5, pumping blood into the umbilical cord, which connects the baby to the placenta. By 9 weeks, limbs, fingers and toes have formed, and your baby is the size of a grape. At the time of your dating scan at 12 weeks, your baby is producing urine and weighs about 28 grams. By 20 weeks, your baby is nearly 10 times bigger, and you can now feel movements. The genitals are fully formed, and boys can be distinguished from girls. At 24 weeks, the brain is developing rapidly, and the eyes begin to open. Your baby now weighs 650 grams, increasing to 1 kilogram by 28 weeks. By 32 weeks, your baby can sense light, hear and make grasping movements, and weighs 2 kilograms. The lungs mature around 34 weeks, and the bones become stronger. At 36 weeks, your baby weighs around 2.5 kilograms. The period from 37 to 40 weeks is described as full term. Your baby is now fully mature and is ready for delivery.